Hi, and welcome back to North Star Physical Therapy Podcast. And for those that are new to joining us, thank you so much for listening. This episode is going to be all about a very common symptom quasi-diagnosis that I get a lot within the clinic here at North Star Physical Therapy for pelvic health. So urinary urgency and frequency. I often get that as a symptom for across any gender, right? Of male, female, trans, asexual, doesn't matter. It isn't necessarily just a postpartum thing. It isn't necessarily just a perimenopausal symptom. It can happen in any pelvis. And so we're going to go over some key components and some key things that we look at as clinicians. And that's why we tend to get our little detective hat on as a clinician, asking you 1,000 different questions about your urinary symptom of urgency and frequency. So they often go hand in hand. You can have an urgency and then have to go to the bathroom. That kind of makes you go to void or to urinate. But then you can also have that urgency and be able to manage and to see, is this a real urge? Is this a quasi fake urge? And what can I do to combat that? Now, this does not mean that everybody needs to do a Kegel or everybody needs to turn on their pelvic floor muscles to get rid of that urge. Sometimes that can make things worse. Not everybody has a urinary tract infection when they have this urgency and frequency symptom. So running to the primary care and getting a urine analysis done isn't always a thing either, because there are other symptoms of a UTI, not just urgency and frequency. This doesn't just mean that you had like a ton of a fluid and like that's the only reason why. So there are several different components. And again, this can be in any pelvis, woman, man, or anywhere in between or on the outside. So when we talk about urinary urgency, we also want to know if there is any leakage to that accompanies that. So we call that like urinary urgency dry and urinary urgency wet. And so we kind of want to see, is there any other symptom that's accompanying that? Because that could help trigger which line of treatment we go down. And so there can be several components, and the just some to name off a few, right? Is there anything normal or common about these components, right? So just because you're having this symptom does not mean it's common. Just because you have this symptom doesn't mean it's normal, right? So a lot of people think that going to urinate maybe once or twice a day, oh, that's normal. It's just a couple times. Wrong. Oh, it's totally normal that I'm getting up and going to the bathroom like 3 times a night. Wrong. It is not. That is not normal. We want to have enough intake of hydration into our system where the output, or when we're getting that signal to our brain from our bladder of you need to urinate, we want to make sure that that is happening every 2 to 4 hours during the day, maybe 1 at night, okay? And sometimes we can factor in that one time getting up and going to the bathroom may have been because of a later hydration. It maybe could have been what we hydrated with later on that evening. But the normal frequency of urination should be every 2 to 4 hours during the day, maybe getting up one time at night. That does change a little bit in certain times of our life. For example, for those that get pregnant, we may be urinating more frequently during the end of the pregnancy because our bladder is being squished. It is being played on like a trampoline. And so the filling capacity of our bladder is in a different shape and a different capacity because of the pressure from the uterus and for baby jumping on it pretty much and squishing it, then it can't fill as much. And so whatever it does fill, that signal is being sent like, yep, we're good. We can fill all that we can. You got to empty this out. So that tends to be a little bit more like the 1 to 2 hours, during the tail end of a pregnancy. And that is something that's common and normal, right? But when it is accompanied by like a leakage or accompanied by a burning or accompanied by some other symptom, that's when we start to say, that's not common or normal. When we're in a different stage of our life, for example, when we're a little bit older, our sleep changes and there is a natural release of a hormone that helps reduce the kidney's timing of processing, so it kind of slows everything down while we sleep. So we're not getting up and going to the bathroom because the process was just slowed down for us. When we are getting older, that release of hormone starts to reduce. And so now the speed of the kidney functioning is actually kind of right around the same as it was during the day as it is at night. And therefore, we may need to get up maybe up to 2 times a night as we're a little bit older in our 7th, 8th, 9th decade of life. And that frame of, or that time frame of life, that's where I'm saying any more than twice a night is considered abnormal. So we also want to factor that into consideration. And so that's where we're always asking, are there any other like medications that you're on that could be giving that symptom of urgency and frequency, like a Lasix or a diuretic? Ding, ding, ding. That's a big one, right? Are you on any diabetic medication? Or have that as another diagnosis on board, because that definitely affects the kidney functioning, and the kidneys run hand in hand with bladder. So sometimes it's not always the bladder thing. Sometimes we may need to go up and look at what's going on with the kidneys. So medications can absolutely have that side effect to that. We also want to look at your nervous system. When we are super worried or really anxious or in pain, or our nervous system is just heightened so high, that could also be giving some rise to that urgency and frequency symptom. We want to look at the overall lifestyle. Like I often tell folks, walk me through a day. When do you get up? Yeah, when do you have that first void? When do you eat for breakfast? When do you have to drink first thing? Do you go work out? Like, tell me that. What are your work hours? What do you do after work? When do you go to bed? So it's like I'm asking about all these things, and it's not necessarily being nosy. It's just being encompassing of any kind of little tweaks to that lifestyle that maybe we can factor in. For example, if someone has a lot of urgency and frequency towards the end of their day and into the evening, we're looking at their hydration timing throughout the day, looking at their voiding timing throughout the day, to see if can we just kind of shift that up a little bit, so that way you have more opportunity to do that emptying during the day instead of everything's happening between like 5 p.m. and 10 p.m. It's like, okay, yeah, so your bladder's getting like overloaded here. So we look at that with our lifestyle, like timing. We're looking at those behaviors. Are we getting any kind of like signals, like auditory or visual signals that cause some of those urges to come on? Like, for example, we're pulling up to, the driveway after a long day of work, and it's driving into the driveway, turning off my car, and knowing like, okay, the bathroom's just right inside, but now I have an urge, but I haven't had an urge at all throughout my full ride home. Or when I turn on the water, and there's the auditory of the water going down, and then now my hands are wet, and now there's like that tactile cue too. Or again, just hearing it. Or is it that visual? Like I see the bathroom sign every time I walk by at my office, back and forth, or something like that. Is there something that we can maybe tie it into, like flagging in or triggering that urge to come on? So we ask those kind of questions. I ask questions and I observe the kind of posture that we are in sitting in and standing. So that way, is there any kind of orthopedic or muscular thing that's giving rise to that urgency frequency? We are also looking at any other kind of bladder irritants, or we get back to like the muscle and the fascia, the soft tissue in there and the connective tissue to see, like, is there any tension that could be kind of compressing or irritating the nerves that supply that area as well. And so the body's getting kind of confused. Well, I think I'm getting an urge signal, but really it's because this nerve is kind of irritated from this muscle being so taut, or this fascia being so taut from a scar that I got from a surgery. So we're looking at everything. So as a pelvic health physical therapist, there are so many different components and possible contributing factors that can go into just this one symptom that we really have to take the time and take a step back and look at all of it. So that's why on evaluation and for the first few sessions, even after that within treatment, and I'm always asking my folks, was there any question from last time? Was there anything that we were kind of processing through? You came back, you know what? I remember this now. And so I'm always asking that question, or if you got any symptoms with the treatment that we had, how long that lasts for? Were you able to tie in any of those like urge drills, or were you able to adjust that one little lifestyle thing, and how did that affect any urgency? Did it reduce the urge? Did the severity go down? Or now the more we're in tune with our bodies and really now listening to it a little bit better, instead of, that first urge of, there's something in my bladder, gotta go. It's like, no, can I kind of relax? Can I take some deep breaths? Can I adjust my posture? Can I maybe put down that third cup of coffee for a hot minute? So that way my, things can kind of process a little bit more. So we're always asking these questions, and we're not necessarily being nosy. We're just really trying to get down to the bottom of these contributing factors that can help alleviate this symptom, because nobody wants to be honestly like consistently having urge, and then I go, and then your whole life revolves around being close to a bathroom. That's not quality of life. So my one big takeaway for this podcast is, if this is speaking to you or a family member, if we have this symptom of urinary urgency and or frequency, you need to track. You need to track so many things, but it is so important to have that system in place, whether it's old school pen and paper, if it's little notes on your phone, if it's an email to yourself, if it's a post-it note, for all I care, don't care. I almost always give my folks a urinary and bowel journal or diary to get this information of, yes, of course, how much are you drinking and what are you drinking? What is the output? So I literally give them a cup, a little like measuring cup. All my clients, it's a disposable measuring cup that has how much, not just guessing or counting 1 Mississippi, 2 Mississippi, 3 Mississippi. And by the way, that was something that I used to tell people to do. I learned from the latest and greatest research that really the flow rate for everybody is so very different. So to do off of counting is not accurate. So now I give people a cup with the measurements on there. So you will measure how much is getting out. Was there any leakage around anywhere? Did we have to double void? Did we feel like we didn't fully empty? What is your sleep hygiene like? What is your nutrition like? Did you work out? Right? So I'm asking people to track certain things depending on what they're telling me, and getting some common patterns here. Oftentimes there is a pattern, but we don't know unless we track it. And so for something like this, I just say we want to track a few days in a row. Now, when I was doing my training, I did this for a whole month straight. And man, did that teach me so much about my bladder health, like my level of distractions with things. So I definitely have folks like, we need to maybe set timers for you to go because you're easily distracted versus we need you to tap into your body and really see, is there some low-hanging fruit lifestyle things we can adjust for, and or tapping in to see, okay, is this really a real urge? What can I do to manage and adjust it? But we also have to factor in there maybe some other components with the medical side that we may need to get some further answers on through your other medical providers first. So many different components with just one symptom, but that's what pelvic health is all about. It is the one area of our body that has a lot of automatic functions, but it does have also muscular skeletal things going on. There's nervous system things going on. There's lymphatics going on, there's vasculature going on, and then you go right above the bladder and there's the kidneys, and it's like there's other organs and their functions going on. So there's a lot of stuff within the abdominal cavity, within your pelvic cavity, that as a pelvic health provider, we have to step back and look at the full picture. So I hope this kind of helps paint a little picture there of when you have this symptom, I want you to really track, right? Was this a one-off thing? Was this because I went into a happy hour with my girlfriends and I had a little too much wine and that's why I'm kind of feeling like things are just flowing out? Is it because, you know what, no, every time I'm like at work, my office is 2 doors away from the bathroom, and so it's just right there. Or every time I drink after about this amount or after this time of the day, that's like track this stuff. Track how much you're having and what you're having, how much is exiting your body, because that can tell us what's going on at the kidney level too. Track, you know what, did I not get a lot of good sleep and I kind of feel like poop and that's why I'm grabbing the coffee and that may be a bladder irritant because now I'm peeing a lot more today. You know, what was going on with that sleep hygiene as well. So track your symptoms and then bring that into your therapist, and then that way we can get down to the nitty gritty and really nip the problem at the source instead of just trying to, guess. So I highly, highly recommend for any of those suffering with urinary urgency and/or frequency to please track when you're having the symptom and what's going on around that. All right. And again, that can be for anybody. Everybody has a pelvis. Everybody has a bladder. So this can absolutely happen to anybody. It's not just a postpartum thing. It isn't just even after a prostatectomy. It can be at any time. So we just want to make sure we're helping you so your quality of life remains high, so you don't feel like you always got to be around a bathroom. All right, y'all, until next time.